So the next type of necrosis that we are going to now begin with is going to be the third one, that is caseous necrosis. Now this particular necrosis has a fancy name, that is, there is something that has come up, that is caseous. Very important, what is the meaning of this word caseous? Caseous means cheese-like. It means cheese-like. That is, if there is an organ which is showing caseous necrosis, what will be the appearance to the naked eye? What will it appear as? It will appear cheesy, cheese-like appearance. Now what you need to know is actually caseous necrosis is a combination. That is a very important question, students. It is a combination of what? That is coagulative necrosis as well as liquefactive necrosis. So the first two types of necrosis that we discussed, coagulative and liquefactive, when you club both of them, what you get is caseous necrosis. But students, there is one particular point that you need to know over here. Sometimes in the question, the examiner might give coagulative and liquefactive as separate options. Now, when you are dealing with such tricky questions, remember, if you get such a question and you have to make a decision between coagulative and liquefactive, the answer will be coagulative. So, it is more of coagulative necrosis than liquefactive. But students, if you have an option saying both, then the best answer will be both coagulative and liquefactive. If you have to select any one, then the answer will be coagulative necrosis. Now coming back to what we discussed just now, cheese-like. Now if this is a combination of coagulative and liquefactive, neither was coagulative showing any cheesy appearance, nor was liquefactive showing any cheesy appearance, then how is the combination coming up with a cheesy appearance? So there is something definitely different that is happening here. Now this cheesy appearance is because of certain infections. If you notice the examples, you will know why this cheesy appearance comes. This is seen in a very important infection, that is tuberculosis. In our country, in our setup, a very important infection, that is tuberculosis. Other than that, it is also seen in histoplasmosis, so with histoplasma infection, and it is also seen in coccidiomycosis. Now these are few examples where we will see caseous necrosis. Now what is important to know over here, all these infections that we've just enlisted, there is one thing common to them, and what is that? That is that all these infections or these infective agents in their cell wall have a very high lipid content. They have a high lipid content in the cell wall. And if they have a high lipid content, what appearance will they impart? You are right, they will impart a cheesy appearance. So what is different in caseous necrosis? The organism. For example, tubercle bacillus, Mycobacterium tuberculosis. This has very high levels of mycolic acid in its cell wall. This is going to give the cheesy appearance. So because of a high lipid content in the cell wall, the appearance becomes cheesy. Ultimately, what you have to know that it is a combination of coagulative as well as liquefactive. Now the trend, as all of us know, is of image-based questions. So this is the image that you need to know for caseous necrosis. And I told you one basic rule and one mantra for solving all such questions. Identify the organ, the parent organ. Now what is the parent organ? If I draw it out like this, this appears to be the shape of a, this appears to be the shape of a lung. However, that can't be the only defining feature. If you just focus more on these spaces that we have. So if you focus on these spaces, you will see that these are actually the air spaces. So the way that we can identify the lung is not only by the shape but also by the air spaces. So these spaces are known as the air spaces. Now there is one particular area in this diagram that you can see is separate. You are right, this particular area. And students, like we just discussed, this is the cheesy appearance. This is the cheese-like area. So which necrosis will this be? You are right, this is an example of caseous necrosis. This is an example of caseous necrosis. So a very important condition. Caseous necrosis, given a specimen of the lung in the Indian setting, the first infection that should come to your mind? You are right, pulmonary tuberculosis. Now you know why the tubercle bacillus is causing cheesy appearance, because it has a high level of lipid in its cell wall. So coming back to our theoretical aspect, this was our third type of necrosis. Now let's go on further and discuss the fourth type. The fourth type is a simple one because it has everything in its name. It is known as fat necrosis. It is known as fat necrosis. So automatically, students, you can now clearly understand where will this type of necrosis occur? In the fatty tissues. Let's take two very easy examples. For example, in the breast, and second, in the omentum. Now we know these are two areas or organs which are very rich in fat, lipid. What happens if in the breast there is any trauma? Trauma to the breast means trauma to the fatty tissue in the breast. The fatty tissue will break. When fat breaks, what is formed, students? You already know from your basic biochemistry. Fat will break into fatty acids. Fat will break into fatty acid. Next, come to the example of omentum, very rich in fat. Okay, now what is the enzyme that breaks fat? Fat is also known as lipid. Enzyme to break lipid will be correct. It is lipase. So lipase is the enzyme that will break the lipid in the omentum, and what will it result in the formation of? Again, fatty acid. But there is one concept that you need to know. Where is this lipase in the omentum coming from? Omentum doesn't have lipase. Where is it coming from? This is coming from a very important organ when it has an inflammation, that is acute pancreatitis. That is acute pancreatitis. Now this is very important, students. Acute pancreatitis, it releases lipase. Lipase acts on the omentum, and the omentum will, fat in the omentum will break into fatty acid. This fatty acid, students, will then combine with calcium. You know right from the days when we used to study chemistry, this is known as saponification. This is known as saponification. Now students, what you need to understand over here, acute pancreatitis releases lipase. That is going to result in breakage into fatty acid. Fatty acid will combine with calcium. That is what we have studied in fat necrosis up till now. Now when you try to correlate this concept with something that we study in medicine and surgery, how will you prognosticate a patient of acute pancreatitis? We have certain criteria, as all of us know. We have the Ranson's criteria and we have the Apache's criteria. These are two criteria that are used very commonly, that is the Ranson criteria and the Apache's criteria. Both of these use one very important parameter, that is serum calcium. Now we can say that as the level of or the severity of acute pancreatitis increases, if you just follow this basic flowchart, as the severity of acute pancreatitis increases, which enzyme will be released more? Lipase. When more of lipase is released, it will act on the omentum. It will break the fat into more of fatty acids. More of fatty acids will then combine with what? They will combine with calcium. So all the calcium that is normally circulating is now going and combining with these fatty acids, resulting in fat necrosis. So what will happen to the serum calcium level? You are correct, the serum calcium level will decrease. because all the calcium from the serum is going and combining with the fatty acids. Now this concept is very commonly used in these two prognostication criteria, Ranson's criteria and Apache's criteria. So as I had said, with pathology you are forming a foundation for medicine as well as surgery. Now coming back, core pathology. When something has deposition of calcium, it will always become chalky white. That is a concept you need to form now. Chalky white means calcium. In fat necrosis, fatty acid is combining with calcium. So now let's see an image of fat necrosis. Now this particular area is a section that has been taken from the omentum. So you can visualize all these yellow areas that we have. All of this yellow tissue is the fat. Fat is always, to the naked eye, it is yellow in color. So this is fat. Also what you can now see very distinctly are these whitish areas in between. These are the chalky white areas. These are the chalky white areas. And if you see such areas, which type of necrosis are we referring to? You are correct, it is fat necrosis. Coming back to the theoretical aspect, we've completed 4 important patterns of necrosis. Now we will move on to the 5th one. The 5th one is known as the fibrinoid necrosis. The 5th one is known as fibrinoid necrosis. Again, the beauty of the subject is focus on the term and you're halfway there. What are we dealing with now? We are dealing with fibrin. Okay. Basic concept, time to form some concepts. So fibrin is something that is pink in color. First, it is something which will be pink in color. Second, whenever in pathology or in any subject you come across the word fibrin, remember this is something to do with an antigen and antibody combination. What do you call a combination of antigen and antibodies? So this is to do with immune complex formation. Immune complex formation. So this is to do with antigen as well as antibody complex. Now friends, what we need to know are certain examples. Where will you see fibrinoid necrosis? Very commonly this is seen in vasculitis. This is seen in vasculitis. Particularly there is a vasculitis called PAN, polyarteritis nodosa. One very important vasculitis when we will deal with blood vessel pathology. Polyarteritis nodosa shows fibrinoid necrosis. So if you get the image of a vessel wall, you see a vessel, in the vessel you have pink color deposition. Which vasculitis will you think? PAN. Which necrosis will you think of? Fibrinoid necrosis. So that is exactly the next image that we need to see. This is the image of a blood vessel. How do I say that this is a blood vessel? How do I say that this is a blood vessel? This is the center, the lumen. Can you appreciate that the lumen has these red color structures? These are the red blood cells. These are the red blood cells. Red color structures, red blood cell. Lumen में red blood cells सिर्फ blood vessel में present होगा. Now focus on the wall. Focus on this particular area. Can you appreciate that this band that I have highlighted, this is pinkish in color? So this is because of what we call as fibrinoid necrosis. This is what we call as fibrinoid necrosis. So I told you, you see a blood vessel, you see pink material in the wall, fibrinoid necrosis. Which vasculitis should come to your mind? Polyarteritis nodosa. So you've done the first very important example. The next example that you need to know, this is also seen in malignant hypertension. This is also seen in malignant hypertension. In malignant hypertension, if this is a cross section of the blood vessel, what is happening? The tension or the pressure is increasing on what? The cells of the blood vessel. What is the lining of the blood vessel? It is endothelial cell. Again, a very important basic thing about pathology. Every blood vessel is lined by an endothelial cell. अब blood vessel के अंदर अगर pressure बढ़ेगा तो वो जाके endothelial cells को damage करेगा. That pressure will hit on those endothelial cells. The pressure increases, endothelial cell gets damaged. Then the material starts going into the vessel wall. And all of that fibrin from the blood now starts going and gets deposited, pinkish material gets deposited in the vessel wall. This is what we know as fibrinoid necrosis. So now you know the second example, malignant hypertension. The third and the last example that you need to know for this particular category is something that we know by the name of Aschoff nodules. Now this is one very important feature. Aschoff nodule is seen in a disease called rheumatic heart disease. A very important disease of cardiovascular pathology, which we will discuss eventually. But the formation of basic concept over here is that rheumatic heart disease has a very characteristic feature, that is Aschoff nodule, or also known as Aschoff body. And this is going to show presence of fibrinoid necrosis. Okay, now we have done the fifth type, that is fibrinoid necrosis. Now we are going to go to some special types of necrosis. What are those? There is one special type that we know as Zenker's degeneration. That is known as Zenker's degeneration. Now why is this favorite with the examiners? Because ये जो term है इसमें necrosis कहीं नहीं आता. So we know that although this says degeneration, but actually this is a necrosis. Why have I called it a special type? Because this is special only in terms of the clinical practice. When we as pathologists come across this term, we are talking about nothing but coagulative necrosis. Now if you remember coagulative necrosis, the first necrosis that we studied, it was the most common pattern of necrosis. Zenker's degeneration is nothing but a coagulative necrosis. Why is it special? Because this is the necrosis that is seen in certain infections like typhoid. Patients of typhoid will show Zenker's degeneration, or you can say coagulative necrosis now, where this is seen primarily in the skeletal muscle. This is seen primarily in the skeletal muscle. Sometimes can also be seen in the cardiac muscle. Amongst the muscle groups, that is the next question. Please note the next question is, amongst the muscle groups, the common ones affected are the rectus abdominis, and the diaphragmatic muscles, the muscles of the diaphragm. These are very commonly affected. These muscle groups are very commonly affected. So students, Zenker's degeneration, remember every word that we have discussed over here is a high yield point. Every one of these is a important MCQ that you need to know. Question number 1, what type of necrosis is it? Correct, coagulative. Question number 2, what is special about it? Which infection is it seen in? It is seen in typhoid. Where is this necrosis seen in a patient of typhoid? It will be seen in the muscle. Which muscle most commonly? Skeletal muscle. Which muscle group commonly? The rectus and the diaphragm. So every word and every sentence that I've told you about Zenker's degeneration are either previous year questions or are potential questions, very high yield information. Now we come to the seventh and the last pattern of necrosis that we need to know. Now remember, this is also a special type. What we call it is known as gangrene. We call it as gangrene. Now gangrene is a term that you will come across very commonly in the surgical wards. Patients of gangrene are admitted in surgical wards, and you will see that the surgeon uses two terms. Either he says that the person has a dry gangrene, or he says that the person has a wet gangrene. Dry gangrene and wet gangrene. Now what does he mean by these two? In both of these, dry gangrene happens because of ischemia, that is a decrease in the blood supply. Wet gangrene also happens because of ischemia, but there is one additional point. This also has presence of infection. Superadded infection is also present. That is what differentiates a wet gangrene from a dry gangrene. Wet gangrene will have which additional feature? It will have superadded infection. Now comes the next set of questions. Dry gangrene is usually seen in the lower limbs. Dry gangrene is usually seen in the lower limb. And wet gangrene is usually seen in organs. And for example, we have organs such as intestine. Organs such as intestine. So students, gangrene, I told you, dry and wet. But next question you will ask me, why are we discussing this under necrosis? I told you it was a special type. What do I mean by that? The surgeon will say that the patient has gangrene, but the pathologist, how will the pathologist look at this? The pathologist will say that if the person has a dry gangrene, it is nothing but coagulative necrosis. It is nothing but coagulative necrosis. And if the surgeon says that the person has wet gangrene, for the pathologist, it will be nothing but liquefactive necrosis. So are these separate types of necrosis? No, these are primarily the same concepts that we had formed, but clinically they are separate entities. Remember, dry gangrene, coagulative, wet gangrene, liquefied, so liquefactive necrosis. Now a quick review at the image of this particular concept. So over here you see the lower limb image and you see how the toes have become black, blackish discoloration. Lower limb, blackish discoloration, which type of gangrene? Correct. Now you know it is dry gangrene. What I've added to the knowledge is that it is coagulative necrosis. So excellent. Let's move on to the next image. Intestine showing this area. Which type of gangrene? Correct. Wet gangrene. But from the pathologist's point of view, which type of necrosis? Liquefactive necrosis. So this becomes our basic about the different types of necrosis. And friends, remember, out of all of these, the most common type of necrosis was coagulative necrosis.